Hello, Dr. Tim Shaver at Arthritis and Rheumatology Clinics of Kansas. Today I'm going to talk to you about lupus, one of the diseases we treat here in this office. Lupus, formerly called systemic lupus erythematosus, is a disease we see here in this clinic, and it's what we call an autoimmune disease. Lupus is something that affects about 1 in 1,000 people in the U.S. population. It's more common in non-Caucasian ethnic groups. It's about 8 to 10 times more common in women than it is in men. And if we look at a target group, 1 in 250 African American women have lupus. So it's a very common disease in that population of people. Lupus is something that has a highly variable presentation. It has a lot of different signs and symptoms we can see. Most patients come in with skin, rash, and joint symptoms. The rash is often going to be in sun-sensitive areas such as the face. It is a very difficult disease to diagnose. It can also involve many other organ systems. It can attack the lining of the lungs and heart. It can attack the kidneys, the cells that form your blood cells. Also, the blood cells can be attacked by your immune system and can become dangerously low, and we have to treat that problem too when that comes up. So really no two lupus patients are alike. It has highly variable manifestations, and we tailor the treatment to the severity of the disease. Diagnosing lupus is very challenging. There's really not one antibody test we can say that will tell you you do or you do not have lupus. It's just putting a lot of things together at once. So it's a very challenging disease to rule out and to rule in. And that's why oftentimes it will take a specialist to make that determination. We are very dedicated to making that diagnosis accurately in this clinic, and hopefully can do that for any of you who may have lupus or may think you have lupus. Once the diagnosis is made, then we have to balance out the risks and benefits of therapy. And really, because lupus can be a very serious disease, sometimes we have to treat it very aggressively, but other times we can treat it more conservatively. The mainstay of therapy for most people are anti-malarial drugs, such as hydroxychloroquine, that goes by the trade name of Plaquenil. We can use other medications that will more powerfully suppress the immune system also if necessary. So for example, if kidney involvement is occurring, that's often going to be something we need to do. We like to minimize the use of steroids. Steroids are often used in lupus patients, steroids such as prednisone, and they can actually be very helpful for controlling the disease acutely, but with long-term use, there are many side effects we have to watch. So definitely our role in treating these patients, and one of our big goals is to get the prednisone dose to a minimal level or off altogether, and we can do that in the majority of people if we just treat the disease correctly. And really with proper management and surveillance and monitoring, lupus is a disease we can manage. We have several challenges ahead of us to doing that. We're not exactly where we want to be yet, but we really anticipate a lot of advances will be coming in the next few years that will allow us to diagnose and treat this disease more effectively. So we look forward to those challenges and to having our patients managed under the new medications. And we hope that if you happen to be someone who's suffering from this, or if you have a family member suffering from lupus, that you would entrust your care to us. Thank you very much.